All right, good morning, everybody. Thank you so much. And again, to members, I know the roads are tough, so thank you for running here. Catch your breath if you want to. Thank you, Representative Zeleznikar. She's passing out some treats today. Appreciate that very much, and we'll get started. So welcome to the Workforce, Labor, Economic Development, and Policy Finance Committee. Today is March 18th. Our first business will be to approve yesterday's minutes of March 17th. Representative Johnson W., have you had a chance to review those?
Yes, Mr. Chair, I'd like to make a motion to approve the minutes.
Representative Johnson has made a motion to approve the minutes from yesterday. Anything further? Hearing nothing. All those in favor signify by saying aye.
Aye.
Any opposed? Minutes are carried from yesterday. Members, we've got about 5 bills on the list today. We are going to start a little bit of a change with the agenda. So we're going to start with Representative Mueller's bill, House File 3597. I think we've got enough folks here today, so let's go ahead and start with Representative Mueller. Welcome to your committee. It's good to have you front and center today. So would you please review the bill, and it's all yours.
Great. So, Mr. Chair, I think the plan is to move the bill to the General Register. I'd like to make a motion to move the bill to the General Register, please.
That is the plan.
Thank you. So House File 3597 was a bill that was brought to me by one of my constituents who wrote me an email and was trying to help me understand why the Minnesota Paid Leave Program would include corporations. She writes, can you please explain to me how a 100% S corporation owner paying him or herself wages is not self-employed, and how this is different from that exact same person running their own LLC or business? And so House File 3597 would exempt S Corp officers and owners that own 25% or more of the employer corporation from paid family leave and medical leave. This was introduced after hearing from my constituents and then several others over the interim, and it became clear that there was some confusion as to why these specific business owners were still incorporated into PFML law, despite not being part of the unemployment insurance tax and program. The definition of S Corp owner is pulled directly from the unemployment statute that exempts them, making sure that there is increased consistency across state law. By doing this, we would cut down on confusion by small business owners on why they are in PFML, but not in unemployment. And Mr. Chair, I have there are some people who would like to.
All right, I'd like to ask the testifiers to please come forward, if you could. First one is on Zoom. I don't have a name, so we're just going to. Amy, is it on the other one? Ms. Carlson, welcome. I hope you can hear us okay.
I can hear you, thank you.
Thank you, and we hear you loud and clear as well. Please introduce yourself and proceed with your testimony to House File 3597. Thank you.
Okay, thank you. Good morning, Chair Baker and members of the committee. My name is Amy Carlson, and I am the owner of and sole proprietor of Amy Carlson Hair Studio in West St. Paul. I am an S corporation. I'm very proud of the business that I've worked hard to build over the last 23 years. I'm here to testify against HF 3597 as an independent business owner. My access to health insurance, long or short-term disability insurance, and the paid leave is incredibly limited. At a previous commission salon, I was offered and carried paid leave policy through AFLAC. When I left to create my own business, I was able to carry that existing plan forward. When I had to leave and use 2 weeks for injury and put in a claim for compensation, I was sadly not surprised to find out that it was essentially a worthless program. I was paying high premiums for an absurd amount of coverage and not paid out what I was owed. I want to be part of the Minnesota Paid Leave Program. I myself want excellent coverage should I become sick, should my mother or in-laws become sick and need my care, or my 2 children or my husband become sick and need my care as well. This is the most accessible and affordable option, and also the most comprehensive. Additionally, I want paid leave to be available to every Minnesotan, to be available to my clients who are like family to me. And as a hairdresser, I know more about everybody that sits in my chair and their health and well-being than most people in their lives. I can tell you that there's a lot going on in people's lives, and I want to contribute to the paid leave program so that every Minnesotan can have access to taking the time they need to care for themselves and for others. I am more than happy to contribute to the program that not only I may benefit from myself, but every Minnesotan may benefit from. Isn't that what we are meant to do? Care for each other? I urge you, do not pass this bill. Thank you.
Thank you, Ms. Carlson, very much for your testimony today. Next up, we have Ms. Martinson, Kelly Martinson. If you're in the room, would you please come forward? And welcome. Introduce yourself, please, and proceed with your testimony.
Good morning, Good morning, Chair Baker and members of the committee. My name is Kelly Martinson. I'm the owner, president, and CEO of K-Square Writing, Inc., which is an S-Corp. There are many advantages to owning your own business. However, access to benefits is not one of them. When my oldest child was 10, he was diagnosed with a brain tumor. Thankfully, I could do my job from anywhere, which was helpful during his first 10-hour brain surgery while he was in the ICU, during the countless hours spent waiting while he was having MRIs, and during the 3 months of proton radiation he received in Boston, where we temporarily relocated, where I worked on the train and in the waiting room and on the train again as we commuted daily. I use the words thankfully and helpfully sarcastically because I had no choice. I was the primary earner in our family while my husband cared for our 3 younger children, and I had no option for paid medical leave. So I worked as much as I possibly could while also parenting 4 young children and managing a devastating healthcare crisis that affected all of us. It wasn't enough. It took 7 solid years for us to be financially independent after his year of treatment. The first time I was able to put any money into a retirement account was 2 years ago. I have one long-term disability policy, which I call my cancer policy, because it will only cover any of my lost income when I've already been unable to work for 3 months, rendering it really only good if I personally, myself, get cancer. I am ecstatic to be part of Minnesota's paid family and medical leave program. Ecstatic. It is by far the best coverage available to business owners like me, and at by far the best price. And if I need it, I can get access to it relatively quickly. It would have been a lifesaver when my son was sick. I strongly urge you to vote against HF 3597. It is the job of our government to do the most good for the most of us. Paid family does just that, and we all need to be included. Thank you.
Thank you very much, Ms. Martinson, for your testimony this morning. I believe that there may be some letters in the packet, members, as well, for folks that are sharing their opinion about the bill. Are there any other members of the audience that would like to testify for or against this bill? Seeing none, I'll close public testimony. Member questions to this bill. Representative Chair Frazier.
Thank you, Mr. Chair. Representative Mueller, how many, if we were to exclude all S corps, how many individuals would that be?
Sorry, Representative Mueller.
Thank you, Mr. Chair and Representative Frazier. I don't have the specific number in front of me. Maybe nonpartisan would have a better idea than I would.
Representative Frazier, should we ask nonpartisan? I know we have a fill-in today for Anna, so I don't want to put her on the spot. And we may have to call up Deed if there's a question that maybe technically they could help us with too. So did you have a question on this? Are you able to answer this?
Let me, if Deed is in the room, if they don't
Thank you.
mind stepping to
Thank you, Chair Frazier. Could somebody from Deed come forward and maybe, again, hate to put you on the spot, but if we could just get a ballpark or any information from Deed on this, that'd be helpful.
And Mr. Chair, if I could, I would like to just make a clarification as I'm looking at the bill. If you're looking at the bill on line 2.15, and I would like to have nonpartisan actually clarify this for me. It says entities that are excluded under this section may opt into coverage. I'm telling them that this is not this is what we've been hearing from the chamber, from NFIB, and from thousands of other business owners around the state and in my district. They need options. And what's difficult about this one size mandate from the state is that they don't have options. And so the testifiers that came, thank you so much for coming. You still have this option. And so we want to make sure that, I wanted to make sure that was very clear. And with that, Mr. Chair, thank you. We can go to D.
Thank you, Representative Mueller. Welcome, Mr. Rowe, to the committee. Please introduce yourself.
Good morning, Mr. Chair. Evan Rowe, Deputy Commissioner at the department. We still, I would say we still need to do some analysis to see exactly how many S corps would be how many, kind of what the total would be, just in the sense that there may be a fiscal impact here in terms of premium collections as well as benefit payouts. I think there's a fiscal note request on the bill that the agency's working on, but I wouldn't want to speculate on the exact number until we actually have done the full analysis. By number, there's a decent number of S corps. I think the question is the actual wages that are paid in and what that impact would be. So we'd like to put a finer point on the math before going into that.
Thank you, Mr. Rowe. Again, I think to the bill, this is pretty specific. I think it does, as Rep. Mueller stated, it gives those owners an option to opt in or opt out, similar to our independent contractors. But so folks can understand, currently, like other jobs, some folks can opt out of unemployment insurance or are not exempt or are not included in unemployment insurance as an owner. So this is sort of treating the same thing. We're trying to take the paid family medical leave language and just make sure that we get the little details right in a very large bill. And again, in many degrees, if they are a part owner of a very small S corp, this does not include any employees. This is only for the ownership. You have to have at least 25% of ownership to be qualified for this. But again, it should be, it really should be a very minimal kind of an impact to that. But Chair Frazier.
Thank you, Mr. Chair. And Rep. Mueller, the reason I asked the question, and I think Deputy Commissioner Rowe kind of explained some of it with the issue I'm concerned about. We created this large pool in order to keep these premiums low to provide this incredible benefit for all workers. So I do have questions about how that would impact stability of the program, possibly increasing the premiums for folks that are already in the program. So those are real concerns for me, which is why I asked that question. Another question I had, I think one of the things that was noted in some of the documents I read is that other entities or groups are excluded from unemployment insurance. But there are many groups that are included in this that are also excluded from unemployment insurance. What makes S corps special?
Representative Mueller.
Thank you, Mr. Chair, and Representative Frazier. Well, I think this, in my opinion, knowing that we have different philosophies on this, in my opinion, this is just the beginning of how we try to right-size this program. I hear what you're saying about how many, what the fiscal impact is going to be and all of those things. The questions or the statements that you said about how they may lose, but these are benefits that for many of them, as I've talked to the S corp persons, they can never use no matter what, because oftentimes they are the owners, and if they step away for that amount of time, the business is simply going to fold. So it's not like they can take advantage. They're paying for something that they can't take advantage for in the first place. And so that makes it difficult for them to understand why they're included in the program or why they're mandated to be in the program. Having the choice to be in the program is one thing. And you say increasing the premiums for everyone, they're paying the full premium right now. They're not to be able to divide it out among many of, if they're the sole proprietor, they're not be able to divide it out. They pay all of that. And so it's something that I think that when we talk about right sizing something that if you look at this room, no one has been debating that paid family leave has been a benefit. I understand and have talked about how we need to make sure that we have good ways to take care of our families. But when we talk about making sure we do that, right-sizing the program and making sure that it works the best for everyone in their individual businesses that are super unique and different, that's what I'm talking about with this.
Chair Frazier.
Thank you, Mr. Chair. Thank you, Mueller, for that. The concern I have, too, is when we talk about right-sizing, it sounds like it's just a whittling away of individuals or groups that would be carved out of the broader state plan. If you continue to do that, which I don't know where the end would be to that, which is why I asked what makes S corp special. If you continue to do that, you do destabilize the program, which means that no one would have access to the benefits if the program was destabilized and had to shut down.
Representative Mueller.
Thank you so much, Mr. Chair. And Representative Frazier, again, what you're saying sounds logical. And what I'm saying is that a program that is a benefit to someone, they're going to choose to be a part of it in the first place. You don't have to mandate someone to be a part of something that's already good for them. And so it's really difficult for me to look at my sole proprietors and say, hey, we're going to tell you what's good for you, but you can't actually take advantage of it. And so that's the part that that we're trying to pinpoint right now, as we know that there are questions and there are things that people are still questioning. I'm simply saying for the small amount of people that we would be able to look at, can they opt in instead of being mandated? And so let me just remind people that these people are not able to, the S-Corp owners cannot take unemployment insurance, and they are, if they go on paid leave, it would, they would have their business in closing. And so then no one has benefits at that point in time, because you have to be employed in order to have that, and they don't get unemployment. So those are things that we have to consider when we're making a mandated one-size program.
Chair Frazier.
Thank you, Mr. Chair. I just want to say, so again, when I go back to the concern of folks not having access to this, we heard a testifier say that they have a plan that designed for if they miss at least 3 months, that would then kick into effect. And they called it the cancer plan, specifically for them. And what we're describing, if we allow these carve-outs, and individuals who say they were to believe that they're invincible, nothing's going to happen, I'm going to be able to work, I'm not going to have any problems, and then they were to be diagnosed with a tragic diagnosis of cancer, they then would not have access to the benefit that could potentially help them save their lives and continue their business. I do think we need to be mindful of those particular individuals, and I think that is what this carve-out would do, would cut individuals out like that, or give them a false sense of hope that they don't need this, then they don't opt in, and then they are the ones that are kind of left out in dire straits, and we're trying to avoid that. Thank you.
Thank you. Further member, Representative Johnson W.
Thank you, Chair. Thank you, Representative Mueller, for bringing this bill forward. I think it's just another recognition of why one size does not fit all, and some of the things where this program was unique and figuring it did. As the owner of an S-Corp, I also not only UI, but you also look at workers' comp. And if you're not out there in the field working and stuff, they also you don't have to take workers' comp. So, but I think it's the recognition of how S-Corps work. I like how you said you can opt in if you want, but the way S-Corps work also is you tend to take as few wages as possible, and then you start bringing in the draw, which draw does not, account for that. So you're just trying to, again, make owners figure out how little I can take in wages. But I think there's also the opportunity for the other side of it is owners of the S-Corp were saying, well, I'm being forced to pay into this. Why not just take 18 weeks off? I can pull a draw. I get the state to pull the money out, and then you're also hitting the fund that way too. So I think it's a good option to have people to just be able to drop out, recognizing what S-Corps are, and that they are a small business, and that if they recognize they don't need it, they should be able to opt out. And I think it's a great bill in the recognition of that as we continue to fine-tune this program to what it actually would make it a better program. So thank you.
Representative Schultz.
Thank you, Mr. Chair. Thank you, Representative Mueller. I appreciate that we're having a conversation about the unintended consequences or the certain topics that potentially the state didn't consider or didn't give enough voice to while this bill was being debated here at the legislature, and even as tweaks are being made to it in 2024. And so as I'm thinking about this, Representative Mueller, this is a really important point. I mean, having sat in numerous numbers of hearings on this, I almost feel like this voice to S-Corps wasn't heard during those hearings. And this is a unique challenge. I mean, this is a particular population of Minnesotans who are creating jobs for tens of thousands of people, most likely across the state, and yet they've seen their state be super punitive towards them. increase of taxes, one of the highest corporate tax rates in the nation. You're seeing mandates like earn sick and safe time, and every single one of those things for small business owners is a heavy weight for them. And as you made mention, Representative Mueller, the idea that they are paying in now an additional sum of money to a program that ultimately they can't see a benefit for is something that should be right-sized. I think that from that philosophical perspective, it's something that the legislature should make note of. Just like Representative Johnson made mention of moments ago, what would be the response? What would be the response from my colleagues on the other side of the aisle to that small business owner who, when they are not active in the business because they are out, the business goes under. And in this instance, instead, during the course of a year, they're paying into a program that they can never see benefit from. That is my open question. What is the benefit that they are seeing to this program that they are paying in? Or are they just paying more? That is the open question. Shouldn't every Minnesotan be able to see the benefit of a program like this? So even to the business owner, to the person who has an S corp and potentially experiences some sort of very unfortunate illness, sickness, long-standing issue, does that business shut down for a period of time? But then previously, either their insurance that they have or their career and life's earnings are the things that they are putting into this, but the business is not operating. So where are they seeing the benefit? And I think that we need to think more about those unintended consequences. I know this is just one aspect, right? And I think as we consider what is the right approach for us moving forward, this is one of the key topics that we should discuss in greater detail and find a solution to if we're seeking to best serve all Minnesotans.
Thank you, Representative Schultz. I don't think I heard a question. Maybe just a quick question to Mr. Rowe. I understand there was a fiscal note requested a couple weeks ago for this. Do you know, has it been worked on, or you know where it's at? Because again, to Chair Frazier's request, we don't exactly know, and maybe to the request and maybe the respect of the chair of Ways that's sitting in our committee, we should maybe redirect this to the Ways and Means Committee, just to be sure. But I just want the chair to know this was requested. We don't exactly know the impact of this. It is, again, it is currently collecting 100% of the taxes of these small S Corp folks who, again, largely will never use it because it's not something that they can use. Again, most small companies like this would just continue either to pay themselves if they can in a small business at their regular rate, but they're also just want to have this option just like unemployment insurance. So if you want to ponder that, Mr. Chair, we can do that. I can make that change in this committee. We would like to have it leave the committee today if possible with that request. But again, we know there could be a fiscal impact on this. So Chair Pinto.
Thank you, Mr. Chair. So as I look at this, we're talking about people who are working who would lose coverage if this were to go through. And I think it's important to note that carve-outs do in fact weaken the program. And Representative Mueller, you had mentioned, you said talked about people being able to opt in, but a reminder that that there's an adverse selection problem when you have a social insurance program. That people then choose to opt in just before they have a baby, or perhaps aware of a health issue in their family, whatever else. The way insurance works is that you have a larger pool. We know that the kinds of events that cause people to need to use paid leave are events that happen in all of our lives in some way because of relationships that we have with our family members. We all have health issues that come up, et cetera. And so it really would weaken the program. And I want to note that we heard voices today of small business owners. To Representative Schultz's point, that we weren't listening to voices. We heard from several of them. The people that we heard from are small business owners who asked us to not pass this bill. We have been listening all the way along as this program was created. And I was hearing Representative Mueller and some of the letter writers talk about how these the folks, these workers here wouldn't take time off because the nature of their business. But then I heard Representative Johnson say, and yet at the same time, they might take as many as 18 weeks off. And the way, what I heard is that would be something that actually, if they say, well, what the heck, I might as well take this time off, and that'd be fraudulent at that point. That'd be fraud if they're, because the only way they take 18 weeks off is, I guess, they're claiming to have a baby that maybe they don't have, and they're saying that they have, that there's some illness that's going on. Ultimately, we have to say, look, are these things, is this a benefit that over the course of people's lives that people need in our state? And they are saying over and over again that they do. And fundamentally, my concern here goes back to a comment made by the bill author about this being just the beginning, and recognizing that this is a benefit that Minnesotans have been crying out for years and years and years. And that I do see this as the first step towards dismantling the program. Fundamentally, these are people who are workers who would lose their coverage. If the business were to shut down for a period of time, Representative Schultz, such that they are not working, then in fact, they are not paying, there's no premiums being paid into the program because they're not receiving wages at that point, apparently, if their business is shut down. If they are working and they are receiving wages, then at that point, they get the benefit of this program. And we want to make sure that Minnesotans continue to have the benefit of this program that they have wanted for so long. So for those reasons, and Representative Mueller, thank you for bringing this idea forward. We have to continue to discuss ideas, but this is one that I don't believe should advance at this time. Thank you, Chair.
Representative Greenman.
Thank you, Mr. Chair, and I will be brief because I think Representative Pinto made a few of the points that I was thinking about as we listened to another hearing where we hear real people coming and telling us their stories, and then in response we get dismisses as what ifs, unintended consequences, and the sort of what I feel like I've heard for 4 or 5 years, which is one size fits all, when if you actually look at the program, it's not that at all. It's tailored to small businesses and big businesses. It's, the whole thing has been tailored. And so, but I just actually do want, I think it, because we have heard this so many times, I actually want to ask Deed this question that I think follows up on what Representative Pinto says, which is, if somebody wanted to just take 18 weeks, one, would they be able to do that? And if they did that, what would be the consequences?
Deputy Commissioner.
Thank you, Mr. Chair, Representative Greenman. Every leave under the program is rigorously scrutinized under the law. The department validates identities. The department reviews all medical certification docs. The department consults with the employers as appropriate. The department, uses a variety of other administrative data, and the department also receives, takes in tips from the public to ensure that the program is not being abused. I would say that is, one of the foremost priorities of the program is ensuring that these, public funds are safeguarded and that, leaves, are adjudicated in line with the law.
Representative Greenman.
Thank you. I appreciate that. And I think it's important that we continue presenting accurate information about what this program is. The last thing I will say, and also following up on Representative Pinto says, Chair Pinto said, is, we continue hearing, we're not hearing voices. NFIB, Chamber of Commerce, all of these lobbying organizations who are here almost every day continue to tell us that they represent small businesses, S Corps, and everything else. And we hear them loud and clear at the testifier table almost every PFML committee hearing we have. So I think the idea that somehow voices weren't listened to when we were designing a program, just at this point is a talking point, and it's a talking point that isn't getting us very far in terms of serving the people of Minnesota.
Final testifier, Representative Zeleznikar. I'm going to hold off on this because I got to move on. We've got a tight schedule today, folks. Again, I do want to just reply to Representative Greenman. Again, there's some letters in the packet from the Chamber and NFIB because of timing today, but I will tell you that many small businesses that I work with in greater Minnesota that have just asked, why don't I have a choice? This is not forcing anybody off. It's a decision they can make. I think better legislation works when people have more choices, but it still stands up a strong program. I don't think this is going to affect it. Representative Zeleznikar, final.
Thank you, Chair Baker, and thank you, Representative Mueller. If I understood you correctly, the owners, these S Corp owners, may choose to enroll in this. So whatever that number is, it's not a large number in the big scope of businesses, but half of them may choose. I think the point is, it's not taking away anything, it's just allowing choice. I think there's a similar conversation because I've had many employers reach out to me in northern Minnesota saying, we have J-1 visas that are here that also don't have to pay into unemployment, but they're here for 3 months to work or in that period in different scenarios. And those employees would also be paying in. And they want the money on their paycheck because they're not ever going to use the benefit. So I appreciate that you're bringing some of these items for us to consider because we want to have the program have the availability, but when people aren't even able to ever use it, that creates a whole nother conversation. So thank you.
All right. Again, we have your bill in front of us. Right now, it's going to be referred to the General Register unless the Chair Frazier would like anything different. Maybe it doesn't matter, but just I want to give you kind of a final thought on this if you want to change that. If not, we'll just take the vote. And I think that we are, sorry, I want to go back to Representative Mueller. Go ahead, do that. Yes.
Thank you. First, before I do that, you had asked the question if where the fiscal note was, and he never got a chance to answer. So I'd like to have Dee be able to answer that question.
Thank you, Representative Mueller. I'm sorry to cut you off.
yeah,
Deputy Commissioner.
Thank you, Mr. Chair. And no, I believe we got the request late last week, if memory serves, and the team is working on it. So I'd expect that we'd be able to get that information again. I do think that there are, as has been discussed in the group, we definitely do want to provide the fiscal background on this because, we certainly want the committee and the body to be able to have the full set of facts in front of them. I think we may just one other point I might just make is it may be helpful to, the bill currently doesn't have an effective date on it, and I guess I would encourage just a consideration around the time that it would take to implement something like this. Generally, switching something on overnight leads to much more confusion and consternation from maybe the people that the bill is intended to help. So that might just be one other just technical point I might offer. I know you didn't ask for that, Representative, but thought I'd offer.
And that's maybe another reason we can kind of work on this again. But Deputy Commissioner, just to be clear, this was requested on March 5th to your office. So it wasn't late last week, it was earlier in the month. So I can show you documentation on that too. There was other requests for some of these bills too that we have not gotten our fiscal notes back on. So,
Mr. Chair, I know that we're pressed for time, but I would just like to respond very briefly.
Yes.
I feel like this is one of those debates where we kind of talk over each other. And I would like to say that, as many voices as you heard today, I've heard just as many. And in education finance yesterday, I heard about how we couldn't listen to a person who was on a task force committee because they don't represent every single person in that group. Well, the two people who came here, and thank you for coming here. Thank you for doing that. You don't represent everyone in my district either. You don't represent every S corporation in Minnesota. And the people who are talking to me, they aren't here because they're running a business. And I'm so glad that you're able to take that time off and come here to testify. But they're not here because they're running their business right now. They don't have the luxury that some others have to be able to come here because they don't have the time because they're doing the job. And so as we think about this, let's stop talking over each other. We understand that we differ philosophically, but a program that is mandated is different than a program that people see value in and they opt into. And we hear it, and I just saw it. They've been asking for this for years. Yes. But they've also been asking for making sure that they have something that makes sense for their business for years. So thank you, Mr. Chair, and I renew my motion.
Representative Mueller renews her motion. What I'm going to do, though, is to the betterment of the body here, is to actually, instead of renewing the motion with it advancing to the General Register, I want to bring it to Ways and Means. I want to give this bill a little bit more time. Deed has not gotten us the fiscal note that has been requested that should have been here by now.
Yep.
Chair Frazier is asking a very fair question, and I think, again, even to continuing to correct, or maybe there should be a date noted in here too for when this would work. How do we kind of implement this? I think that the body should try to do what we can to work together on this. And I think you brought up a very good point, to not overwhelm this, talk over each other. This is just trying to make a program work a little bit better and give a few more choices without certainly tipping the cart upside down. So I'd like to make that motion before we vote on this, right? I have to do this to refer this to Ways and Means. I'm going to give Chair DeFrazier a final, and then we'll take it to a vote, and I think we're going to ask for a roll call. Is that what we're going to do, or are we going to do that, Shane?
I would like to request a roll
So
call.
we'll request a roll call vote on this as well. So, okay, to Chair Frazier.
Thank you, Mr. Chair. I appreciate the conversation, and I appreciate the thoughtfulness. But what I do want to note is, at Ways, we don't typically bring it there to work things out, especially with us being in the tied house. Most things that get to Ways, they're worked out, ready to go, and then the members move it out. I am very much open to having a conversation with you, Rep. Mueller, and we have worked well together, so we will continue that conversation. I would like, and I'll connect with Deed to get that fiscal note to see where things are, and then we can continue the conversation. Then we can bring it back here if we get to that point, but I don't want to send it to Ways and then try to work it out there, because that is not typically how we do it.
Okay. So with that, out of your thing, I think we'll just take it to the register, the general register, and we'll just work it out on the House floor. But we do want to try to get it out of here if I can today. So final, yeah, thank you very much.
Mr. Chair,
again, yes.
Just want to be, that is not what I'm saying.
I know it's not what you're saying, but I think
okay.
As the chair, I'd like to kind of move it along.
All right, Mr. Chair.
And I don't want to stack it up too much. And again, I think that happy to work this on further. If it doesn't move out today, it still sits here, so it doesn't really change anything. But did you have a comment, Chair Pinto? No, okay. Okay, I think we've wrapped it up. Chair, or Representative Mueller, so that the motion on the table is to, with a roll call vote, to take this to the general register, House File 3597, roll call. Chair votes aye.
Chair Pinto.
No.
Vice Chair Meckland.
Aye.
Vice Chair Greenman.
No.
Representative Berg.
No.
Representative Frazier.
No.
Representative Hussein.
No.
Representative Johnson, Pete.
Aye.
Oh, wrong one.
Representative Johnson, Pete.
No.
Representative Johnson, Wayne.
Aye.
Representative Kozlowski.
No.
Representative Mueller.
Mueller votes yes.
Representative Schultz.
Aye.
Representative Zeleznikar.
Zeleznikar, aye.
Thank you very much, members. On a 6-7 vote, the motion does not prevail, and the bill will be held over for further consideration. So thank you very much for your time, everybody. And I'm going to take the testifying table at this point with my next two bills, and I'll have Vice Chair Meckland approach. Thank you.
Right here. Just start right here. Just say Chair Baker.
I think you're first. Rural cancer, right?
Chair Baker, which bill would you like to start with?
Pardon me?
Which bill would you
I'm
like
sorry,
to start
4003.
with? Okay. Chair Baker moves House File 4003 in front of the committee.
And Mr. Chair, thank you very much. I'd like to have a conversation about a bill we worked on last year. And I've got a testifier here to talk about the Rural Cancer Institute. Thank you, members, for supporting this last year. We've got some, I think, tweaks to this to make it a little bit better and stronger. And I'd like to also pass this out of committee this morning as well, hopefully on a voice vote to move it to, again, the general register. So with that, Mr. Chair, I'll turn it over to my testifier.
Good morning. Stephanie, if you please identify yourself and proceed.
Good morning, Chair and members. I'm Stephanie Oman, a volunteer with the Rural Cancer Institute, and I'm offering testimony on behalf of Dr. Wade Swenson, who would like to be here this morning, but he is stuck in clinic. He is the founder of the Rural Cancer Institute and a current practicing rural oncologist. Last session, the legislature made a meaningful investment in rural oncology workforce development by funding the CORE program, the Clinical Oncology Rural Experience. The pilot program will be based at Lakewood Health System in Staples, Minnesota. CORE places medical oncology fellows, residents, medical students, and advanced practice students directly in rural oncology practices, giving them firsthand experience in communities that need them most. It is modeled after the University of Minnesota's RPAP program, which has decades of evidence showing that rural exposure leads to rural practice. Today, I'm asking for your support of House File 4003, a simple but important technical fix. Currently, CORE is limited to participation by trainees who are residents of Minnesota. The problem? Many physicians who practice in Minnesota complete their training in neighboring states or train in Minnesota with plans to go elsewhere. All 3 oncologists that practice at Lakewood Health System are perfect examples. Each trained in adjacent states and chose to build their careers in Minnesota. With only 2 oncology fellowship programs in the state, the need to widen the pipeline of cancer care providers is critical. This bill establishes CORE in its intended form, creating a pathway to practice in rural Minnesota. The need for cancer care in rural Minnesota is urgent, and the workforce available to deliver that care remains limited. I urge you to support House File 4003, a small but important fix. Thank you for your consideration.
Being that's our only testifier, we'll go to member questions. Chair Pinto.
Thank you, Mr. Chair. Yeah, and not so much a question, just a comment. I appreciated a meeting with Ms. Olstrom about this, and I think that this change makes good sense. I'll note, Chair Baker and I and all of us had conversations about how we structure appropriations and grants, and I could imagine that if we went back a year about how we might structure the grant differently in terms of direct versus competitive, et cetera. But this is obviously a very worthy cause for us to have appropriated money to in the first place, and then now that we have, it makes great sense that we would allow clinicians and students who are going to be practicing in Minnesota but may be studying outside of the state to allow them to be a part of this. We want to make sure to expand our pool of rural oncologists. It's a critical need. So I'm supportive of this. Thank you, Chair Baker, for carrying it, and I think it makes sense for us to move it along today. Maybe actually one question. I don't know if Ms. Engel know this. My understanding is that the motion is sent to the General Register, even though this relates to an appropriation, because it's not changing money between accounts. I guess it's okay for it to not go to Ways and just go straight to General Register. Ms. Eng, if that's okay.
Mr. Chair, that's correct. It's a budget neutral bill.
Okay. So then, yes, then I'm supportive of the motion, and thank you, Chair, and thanks to the testifier.
Representative Schultz.
Thank you, Mr. Chair. Thank you, Representative Baker, and thanks to your testifier. I'm excited to hear about this connection to Lakewood Health Systems in central Minnesota. That is the health system where my son was born at, and certainly a high-quality place for people to see what rural Minnesota is really like, and a growing and thriving community there. So excited about this. So thank you again to your testifier and to your team.
And just final thoughts, Mr.
Yes,
Chair? Yeah,
please,
thank you very much
Chair
for this, everybody, and I appreciate the support. Again, Chair Bierman was also someone who worked with me on this, and again, I just want to give kudos to the Rural Cancer Institute, this pilot project up in Staples, Minnesota, thinking really outside the box. I'm glad this committee was able to support it, and I appreciate your support this morning to make sure that we give them the best tools they can so that people that are practicing oncology in Minnesota are going to be here in Minnesota, but they can get some training if it has to be just outside the state, but they're going to practice here. So with that, Mr. Chair, I'd like to renew my motion that we move House File 4003 to the General Register.
Very good. Thank you, Chair Baker. So all those in favor say aye.
Aye.
All those opposed? Motion prevails. Next on the agenda, Chair Baker moves House File 3843 in front of the committee.
Yeah, thank you, Mr. Chair and members. So this one, again, has been something I've been working on for a while. It's about how do we do our direct appropriations in this committee going forward. Last year, as most members know, this was my first year to chair a committee. I was honored to do that as a co-chair with my friend Dave Pinto, and I think that what we learned together was we think we can do this job of allocating dollars to a lot of groups in a better way. and a better way that we can vet it properly. Most of us saw last year, a lot of folks come to us for help and requests. I want to make sure we're looking at that, and again, through the work of Co-Chair Pinto, and I'm not saying that he's agreeing with this, I'm just saying we agree, though, we can do it better. And I think I don't want to put words in his mouth, but I want to say that we've had enough conversations about doing a job better that's vetting it, so we are preventing any possibility of any fraud coming out of our committee work, and that's what I'm trying to do here today. So members, House File 3843 is something that has been, kind of came to us as sort of an idea like we sort of handle LCCMR, the Legislative Citizens Committee that kind of does the bonding work for us. There's a committee, there's a group out there that recommends changes to the legislature. The legislature has the ability to accept that or not. They can change it. The legislature still has complete authority of how we're going to do this. What this bill is attempting to do is to give that authority, and again, my idea here will be explained shortly, is just to have another group outside of us vet it and do some of the things that I found myself doing, my staff doing, and I know the same thing was with the DFL, trying to quickly find out who are these groups that are coming to us in a manner that sometimes is overwhelming in a budget session that can be very hard to manage. So I also, as you all know, we last year approved a workforce task force group that Chair Pinto and I both serve on. I happen to be the co-chair right now of that, and we work a lot on how does this all work in nationally, and how does it work in Minnesota, and the rules we have to follow with federal dollars coming to us, and it's complicated. I couldn't begin to tell you how complicated it is, but I learned so much about this through my work on this special task force, and it's also shared with the Governor's Workforce Development Board. I learned a lot more about what they do, how they do it. It is a good group of people looking at how does the state of Minnesota work with our workforce dollars that we have entrusted to us. Currently, the Workforce Development Board, and what this bill does is it actually asks for a subcommittee of the Governor's Workforce Board to set some time aside to look at the grants that are being brought to you, the requests that are being brought to you, give us a chance to let it be vetted through this group. Then you present us with a report at the beginning of the year, in a budget year, so that we can actually look at it from our purview then with not having quite so many maybe questions, because this report has done a good job in giving us that background of how we can do a better job in looking at our partners that want to help people get jobs, whether it's youth skills, whether it's out of incarceration. There are so many kind of programs that we have supported over the years. I think this is a new transformational way that we can look at how do we do direct appropriations and how do we do more competitive grants, which has sort of been something that I think that I want to work towards. So this bill would require that the Governor's Workforce Development Board do form a subcommittee, give us a report by the 1st of January of every year, bring it to the legislative chairs that have jurisdiction over this committee. The legislature still, though, retains the ability to make any changes they want. We are not exercising any rights to take away our authority. We still have complete control of this. But I think this is a way that we can take and utilize the Governor's Workforce Board. It is already of 60 members. They already have subcommittees under the Governor's Workforce Board. Some are more active than others. This again, may require some dollars to help with some funding with a couple of people, some staff to help run it. I'm not trying to overwhelm the department or the workforce team. But again, I think this is something that in other conversations I've had, this idea is a good one to work through. My hope with this, again, today, members, is to try to move this along. I think we're going to try to move it to Ways and Means. Again, we are still waiting on a fiscal note that has been requested on March 5th. It was supposed to have been delivered by March 16th, and it hasn't gotten to us yet. So I know that, again, Chair Frazier, who's maybe stepped away, he doesn't want to, we want to have this set up as much as we can, but the fiscal notes are slow to coming, and I'm disappointed in that. But I would like to offer up, I have a testifier here that would like to speak to this, Mr. Chair, and then I'll take member questions or if anybody else wants to talk about this. But this is an idea that I'd like to pose in front of us to start working on different ways of us doing direct appropriations going forward. So, Mr. Chair, I'll turn over to my testifier.
Very good. Mr. Donnelly, please identify yourself and proceed.
Dylan Donnelly, Workforce Partnership Manager with Hospitality Minnesota. Chair and members of the committee, my job is to help people get a good job, and this bill is a good idea. Here's the deal. Workforce organizations are funded either through direct appropriation or deed grants, but the results are basically the same. And as the OLA pointed out in an audit, we can do a better job working towards performance-based outcomes. This bill does that. So for us in workforce, the most effective fair system would be closer to like a competitive RFP. But this, again, moves closer to that system. The idea is, let's take these proposals, have them reviewed by subject matter experts, add transparency, align workforce with demand. There's good work being done in workforce, but this is an improvement on the current process that we have. Many of us in workforce welcome a process where the programs that deliver ROI and results get funded. That's good policy. That's what this bill is. And most importantly, this improvement will mean more Minnesotans will get a real shot at a good job.
Thank you.
Very good. Member questions? Representative Greenman.
Thank you, Mr. Chair, and thank you, Chair Baker. As you know, I really care about this issue and have been at Workforce now. This is my second non-consecutive term where it has seemed like the way we sort of do our workforce planning and funding is disconnected from the Governor's Workforce Development Task Force and all of the sort of longer term and even medium term conversations. In our committees, we spend a lot of time hearing really stories about really good organizations that are 3 and 4 minute snippets, and then we usually sort of put together a package based on member interest, based on a lot of things. And I think some of it is a lot of people are on the table thinking about what are the barriers to employment that Minnesotans face, what are the long-term and medium-term demands that we, like healthcare, we talk about healthcare all the time, workforce needs. But at the end of the day, I think our product, leaving aside for a second some of the program integrity questions that I think we've been asking, our product doesn't match I think the work that's happening outside of these walls. And so I appreciate that that this is trying to get us closer to that. This is trying to get us actually in line with what the Workforce Development Board is doing and what the subject matter experts, the providers, and the people who need these services are all doing that collaborative work, which in many cases happens outside the walls of a part-time legislature. My concern about this approach is I think that the 3 questions we have in front of us are like, one, who decides? Like, who decides who the providers are, not who I think our goal should be as the legislature to decide what metrics we want to see, to decide what problems we're trying to fix, and to set the parameters, and I think in a much more narrow way than in some cases we often do, and that is whether it's competitive grant programs or other ways that we distribute money. But the who decides question to me feels fundamental. Then there's the what criteria we use to decide, and then there's the vetting piece to ensure that we are preventing misuse, fraud, and frankly, money going in a place that doesn't match our priorities. And my concern about this approach, and I appreciate this is the first bill we've seen and the first real sort of opportunity on paper we've seen to do this, and I appreciate that. I think this doesn't go far enough because, and I guess a question I have about how this would work is if there is a recommendation from this task force or from this, what are we calling them, this subcommittee to us, and then we vote no, right? I think that's how it works. Like, the board must consider the subcommittee's report, I guess I'd ask a question. So if the legislature rejects the proposals, are they then free to continue doing the work the way that we have done it in this body?
Chair Baker.
Mr. Chair, yes. Quick answer is yes, they can. They can ignore the whole report. If the legislators and the future leaders of this committee want to do that, they have the authority to change that report or to do the direct appropriations how they wish. Again, I think this idea was to give it a vetted system so that, like we do now, it's more timely. This board that's encompassing 21 appointed members from the governor's office, 39 members are in business, labor, and education groups. So these are, I think, experts already kind of representing Minnesota. So if we want to take it, no different again than the LCCMR. We have the ability to change that sort of outlook on how we deploy those dollars. This would be somewhat the same way. So, Representative Greenman, again, I think what I'm trying to do here with this idea and this concept is to have sort of a House position and take it to maybe our friends in the Senate to say, what is your idea to do this better? It may not be perfect right now. We have a very limited time in this session. And again, this is also not endorsed or adopted by the task force in any means. This is just Representative Baker throwing out an idea in my committee that I would love to have continue to work on. But this is my best option, learning about what the Governor's Workforce Board actually is doing now for us, which I didn't realize. I think they could help us a lot. And so that's my point, but we still have all that authority.
Representative Greenman.
Thank you, Mr. Chair, and thank you, Representative Baker. And I share that goal. I think we are in radical agreement on both using the work that is happening outside these walls. My concern, and the reason I'm going to have to be a no vote, but I do hope that before their deadline, we have something that actually deals with this who decides question, because to me, what I worry about is this is setting up a process that looks sort of, it is better than what we have now because we are getting, I think, more information in this committee than we do. But I worry that all of the 201 legislators who have their, a lot of interests, which isn't always like how the system works, but it may be your district, it may be an issue you've worked on or come into. It's a lot of good stuff, but is not, I think, the best way to choose how we invest in and drive our workforce demands. We'll just override and ignore it. So what I would like to see is actually us getting further down the line of saying, how can the legislature do a better job of setting priorities and criteria? I have some thoughts on the criteria, including in the anti-fraud space, but also just in the thinking about how do we do a better job of giving the agencies and the entities in the executive branch the framework and direction that I don't think we're giving them now in our competitive grants. And so that I will say, I really appreciate that we are working on this. I think this is the first term in the workforce where I think we've been actually attacking the structural questions. I just think we actually need to go further and think more specifically about how we do our jobs better as a legislature in terms of setting the broader framework and thinking longer term, and also move the decision-making to the place where they're doing better vetting and I think more systemic thinking. So thank you, Mr. Chair, and thank you, Chair Baker, for doing this.
Chair Baker, any response?
No, I don't hear your question. Thank you.
Chair Pinto.
Thank you, Mr. Chair. And Chair Baker, thank you so much for the work on this and the partnership. We've got the same general direction we're trying to go, and I've appreciated your, and especially the creativity in advancing this. We had a conversation about a couple months ago, and I think maybe just for the benefit of members of the committee and of the public as well, and we talked about a wide range of approaches. We're at the one extreme of maybe where we are of having these individual programs come to us and then the individual decisions about individual amount of money for each one. The version that I've been accustomed to from other policy areas that I think makes a lot of sense is where we set out policy goals, allocate amounts to those policy goals, and then hold agencies accountable for deciding how those dollar amounts go out. We know there's other successful models such as LCCMR and you, Mr. Chair, and I forget if you brought up ORAC in your presentation, but that being a model as well, the Opioid Epidemic Response Advisory Council, which is a similar model. So I really like the creativity there. I guess as I've said to you, well, first of all, I should say, in addition, other than that conversation a couple months ago, I was sort of waiting for the bill, and then I hope you'll forgive me that over these couple of weeks, I just sort of hadn't had much of a chance to look at it before we're sitting here now. So now I'm looking at it in more detail. I guess, as I said to you, I'm worried a little bit that this is almost the worst of, although this may in some ways be better than where we are now, I worry in some other ways that it may be the worst of both worlds, in that, you talked about as a selling point that this would not take away legislative authority to make those final allocation decisions. But to my mind, that's sort of part of the point, is to say that our authority should be about setting goals and total amounts to meet those goals, as opposed to deciding individual appropriations. So one thing that feels like it's really missing here, when I look at the bottom of page 1, a lot of the focus is on things that I actually think we're in kind of an okay shape on right now. We can have staff, when organizations come to us, identify whether the applicant is properly legally organized and has tax forms, et cetera, and past information. What feels like it's missing here is how, under your scenario, would the board receive direction from us about policy goals, to tell them, because this just kind of says, look into whether they're properly organized and then decide where the money goes. But we have policy goals. We want to focus on youth, or on people exiting incarceration, or on particular industries. And how would that work under your bill?
Chair Baker.
Yeah, that's a great question, Chair Pinto. I think, again, that's part of what we did talk about with our meeting that we had together, is sort of what would be our priority buckets, our areas, not only geographically, but maybe just what industries are we seeing real deserts out there with. So I agree with that. I think that in this case, when we are starting up a program, a new vision about this, what I'm hoping that we can do is continue to work this idea that I'm hearing from the DFL, that this is better than what we maybe have now. It may not be perfect. I agree with that. But I want to continue to work on this. But I want to sort of, I think, just send a signal that the House of Minnesota representatives are serious about this discussion about how can we do things better. And no matter what we do here, whether this bill is passed today to move further along to ways, again, there's a fiscal note that I'm still waiting for, but I still will work on that. I think the timing of it, I thought about maybe we make the date, instead of January 1st, maybe we make it February 1st or February 15th, so the new legislative committee can sort of set up what those priorities might be, so they can kind of look at those as they have been vetting people through that period of time. They can sort of like, oh, okay, that's a helpful for the Workforce Development Board to kind of say they're looking for these general high-level guidelines. I don't have it perfectly figured out just yet. Again, this is one of the shortest sessions in my history that I've had, and I don't want to rush it, but I want to make sure that we take a vote on something like this to say this is worth continuing this journey. And again, you're right, we could do some better priorities and how do we set our objectives in the future legislative bodies. But right now, I think this is a good idea to start the process and getting our Senate colleagues sort of helping us with this conversation. But we could do that as we move this thing forward.
Chair Pinto.
Thank you, Mr. Chair. And Chair Baker, yeah, I guess before we get to our Senate colleagues, obviously, we have to have our House consensus, right? And I guess, like even your reference to the report of January 1, under your proposal, the report would be a report saying, hey, legislature, give this amount of money to this organization, this amount to this organization, this amount to this organization. If you're thinking it's after that report that we then say, oh, here are our policy priorities, well, it's kind of late at that point, right? Because we would want the board to take those policy priorities into account when they're deciding the organization. So I guess, this is a maybe unusual circumstance where we've got sort of the chairs having a conversation in this setting, although I'm glad that we are, to sort of sort out, like, hey, how can we come to some consensus about how to move forward on this? Because I would want to have it be that this process would take into account legislative policy goals and figure out how that would work. I'll note the organization that'd be making these decisions would be, the board is entirely gubernatorially appointed, so it's all governor appointees. Obviously, under a scenario where we have competitive grants, that's all agencies appointed, agency heads appointed by the governor. The difference there, though, is we've got a law that we passed that tells them you have to give out the money in this particular way, and we can hold them accountable accountable if they don't. So I want to think about, like, if we don't have that competitive grant model, instead we're doing this sort of hybrid direct one. I need to figure out how accountability works, and how we can have the kind of control over policy outcomes, which is the control we should have, to my mind. And because that quality, I guess, the thing I'm sort of struggling with. I'll note that your testifier talked about, at least I thought I heard him say, that really the gold standard would be competitive RFPs, right? And that's, to my mind, I think I'm with Representative Greenman, that's where I'd like to get to in general. I did want to make sure, Mr. Chair, you said right at the very start about concerns about fraud, and I want to say for myself that's not my motivation when it comes to this policy area, as a concern that direct appropriations somehow facilitate fraud. Obviously, fraud is a massive concern. We need to make sure that we address it, but that's not, for me, the motivation here. I think the organizations receiving funds, I think we've had, there's been some very good work done there by those organizations and by our body, but ultimately the process we use is what I have concerns with. So I'd love to continue talking with you to see how can we make sure that whatever we move forward with as a House position kind of reflects a consensus that we can move forward with. I don't feel like we're at that point now, and I'd respectfully suggested to you previously that maybe this would not be a good thing to bring to a vote now. If you choose to, you're the chair, no problem. And if members on our side vote no, I want to make sure that wasn't misunderstood as not wanting to end the conversation or anything like that. We want to continue talking with you and continue exploring this, and very grateful to you for your work in doing so. Thank you, Chair.
Yep, and thank you.
Chair
Mr.
Baker.
Chair, just do that again. I agree with almost everything you said. I just know that with you and I in our late-minute conversations late last session, we got lucky and had some near misses with some potential fraud that was coming our way that we caught. And I think that had we had a little better vetting system to that, again, I'm not suggesting we're stopping fraud that's happening. I'm glad you brought that up. This is not what this is. I do believe that, and to members in the public think that if we just do a direct appropriation, it isn't that if we award it to someone, the deed instantly writes out a check. It doesn't happen that way. They do a vetting. They have their system in place. State government works better than maybe what it sounds like on the high level. But what we're doing here, though, in my opinion, is making sure that we don't have any near misses again in the future, because there is so much kind of going around. So again, I know the members on all sides, I think, want to do this work. I want to take a vote today on this, Mr. Chair, to just do a roll call is my request, to have this done so we can, let's move it forward. Let's get to work on it. Even if it doesn't pass today, I want to know that where people are at to trying to make a system better, and that's what I'm hoping that we can do today. So I don't know if there's any more questions from members. Okay.
Thank you, Chair Baker. Yes, one more, and if you could be brief, Representative Schultz.
Thank you, Mr. Chair, and thank you to both of our chairs. I just want to highlight and affirm for a second what has been happening this biennium in this committee. This is unique to the legislature. I guess this is my 4th year serving, and the two of you have embodied the way that we should be transparent about what's going on. You did that last session. You're doing it right now. This is the sort of productive conversation that should happen around this table, and I want to affirm you both because you've led that way in this biennium. And I think it's awesome to see where we are finding agreement. I think it's awesome to see the places where our own institutional knowledge or our perspectives from our communities are being highlighted in the ideas that we're bringing forward, which creates a huge opportunity for us to get this right this session. And so thank you to you both, first off, on that. And if we're centering ourselves rightly on this, we can do this together, establish a House position, and ultimately, hopefully, see this across the finish line together. I also want to just get to some of the points that have been raised and say that I too agree, but about many of the principles around this idea that every single legislature will want to establish certain goals as it relates to workforce, and so as it relates to timelines, and when a report is delivered to the legislature, that's important for us to consider. And on top of that, realize that the people who work in workforce development, they're not on a stop and start basis. And so if we can establish principles for a biennium that they're working on a continuum, they're likely can also deliver part of a report that says, hey, these are the biggest things that we're seeing in the workforce, and do with that what you will as the legislature. Add in your own additional confines in addition. Maybe that is the January 1st report, is these are the key workforce areas where we think we have issues at this moment, and then maybe it's a few month period of time. Maybe it's between January 1st and March 1st that they're honing in on what the legislature has deemed as the goals for the coming 2 years. So I think there's a lot of opportunity here, and so I would just continue to encourage this conversation.
Thank you, Representative Schultz, for keeping that so brief. Representative or Chair Baker, if you'd like to renew your motion.
Thank you, Mr. Chair. Again, a lot of great comments today. I think that Representative Schultz has kind of said what I was going to say. I actually have found a lot of validity with what the Governor's Workforce Board is actually doing in Minnesota. They are watching our work as closely as anybody. They also know our state of Minnesota and where the workforce issues are most challenging, and a lot of different reasons. I actually have a tremendous amount of trust and respect for that group, and I think they would come with us with some ideas of how we can do it better. We don't always have the right answers. Even though we represent our districts, I think more outside information and influence would be helpful for us. Again, final decision rests with us. This is my best idea so far, and it's not a perfect idea, members, but I'd love your support today to work on it further. In either case, if it passes today and moves on, I'm going to continue to work on this as one of my major priorities this year. So with that, Mr. Chair, again, I've asked for that roll call, and I'd love your support today to move it on so we can continue to work on this.
To the motion to send it to Ways and Means.
Yes, thank you.
Very good. Well, we'll take the roll.
Baker, aye.
Chair Pinto.
No.
Vice Chair Meckland.
Aye.
Vice Chair Greenman.
No.
Representative Berg.
No.
Representative Frazier. Representative Hussein.
No.
Representative Johnson Pete.
No.
Representative Johnson Wayne.
Aye.
Representative Kozlowski.
No.
Representative Mueller.
Mueller votes yes.
Representative Schultz.
Aye.
Representative Zeleznikar.
Zeleznikar, aye.
With 6 ayes and 6 nays, the motion does not prevail and it will be laid over.
Thank you, Mr. Chair and members. Next on the agenda, if we could have House File 3167, Representative Zeleznikar, if you could take the testimony table. We'll get onto this bill. We've got our 25 minutes total left for 2 more bills, members, so appreciate you watching me watching the clock a little bit. Representative Zeleznikar will move House File 3167, and this will be, and you have 2 amendments. I'll let you actually explain that too. I think the goal today is to move it out to the general register. Nope, laid it over, sorry, thank you.
Thank you.
Your bill.
Thank you, Chair Baker and members. Yes, House, this bill, the A1, removes annual reporting when we have no funding allocated for the bill. And the A2 makes a one-time appropriation of $500,000 for the Center of Nursing Equity and Excellence.
Members, we're going to do 2 separate votes here to give the bill and the author's choice and recommendation. Members, any questions on the A1 amendment that was presented? All those in favor signify by saying aye. Aye. Any opposed? A1 amendment has been approved for 3167 and also to her A2 amendment, which you have already described.
Yes.
So if we could do that, members, any issues, questions for A2 amendment? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? There you go, Representative Zeleznikar. House File 3167 is now amended as your request is, and to your bill as amended.
Thank you, Chair Baker and members. This is a $500,000 allocation for the 2027 workforce for the Center of Nursing Equity and Excellence. It's a partnership with the University of Minnesota Nursing and Minnesota State's Healthcare Center of Excellence. This Healthcare Center of Excellence brings together employers, educators, and policymakers to respond to a nursing shortage that matches the atmosphere right now with an incredibly aging Minnesota population and increased needs for staffing of various settings, from nursing homes to hospitals to clinics. And nurses right now represent more than half of the licensed healthcare workforce. And I will also highlight that it's one of DEED's top priorities is healthcare and staffing. So as we prepare for our aging population, we are going to have to increase our graduates. And so that is the tenor of the bill.
Thank you very much, Representative. I see we have a testifier here today. Ms. Vandenberg, welcome to the committee. If you please introduce yourself and proceed with your testimony.
Thank you. Chair Baker, Chair Pinto, members of the committee, thank you for the opportunity to testify. I'm Elaine Vandenberg. I'm the Interim Executive Director for Minnesota State's Health Force Center of Excellence. Health Force is part of Minnesota State colleges and universities, and in partnership with the University of Minnesota, we co-founded and co-lead the Center for Nursing Equity and Excellence, also known as the CNEE. The CNEE is Minnesota's Nursing Workforce Center. I'm here today on behalf of both organizations and on behalf of Dr. Jennifer Eccles, the center's executive director. We ask for your support of House File 3167 and respectfully request an amendment to increase the appropriation to $500,000 for FY27. Healthcare is Minnesota's largest employment sector, supporting about 1 in every 6 jobs. Nurses make up half of Minnesota's licensed healthcare workforce, and Minnesota is facing serious nursing workforce shortages. It's already affecting patient care, putting a strain on current workforce and limiting access to services across the state. And it's going to get worse without action. Minnesota is one of the only states without dedicated funding for its nursing workforce center. 48 states have these centers, and many, like Florida, Texas, North Carolina, Oregon, and New Jersey, make significant investments. In fact, almost half of the state's nursing workforce centers receive more than $1 million annually. Our request is a fraction of what other states invest. Without this funding, the center is at risk for closure. Without the infrastructure that the center provides, our state will lose its ability to compete for grants that require statewide coordination and established workforce systems, putting us even further behind. Even with its limited funding, the CNEE has demonstrated strong return on investment. With our support with the University of Minnesota School of Nursing and Health Force, the center has leveraged $1.4 million to launch the pre-licensure nurse apprenticeship program. This modest investment shows how we can drive, this shows how even a modest investment can drive larger workforce solutions, particularly in greater Minnesota. The $500,000 requested is practical, near-term solution to sustain this work. It'll allow the CNE to maintain statewide data systems, coordinate partnerships across education and industry, and provide the planning and infrastructure needed to support Minnesota's nursing workforce. It also positions the state to attract additional federal and philanthropic funding, multiplying the state's investment. We recognize this is a non-budget year and funding is tight. At the same time, we also know that you understand the gravity of the situation and the nursing and that the nursing shortage continues to impact care, workforce stability, and Minnesota's economy. An investment in this session ensures Minnesota will have the infrastructure needed to respond, not just to respond, but to move forward with intention and coordination. For these reasons, we respectfully urge the committee to adopt the amendment to fund the CNEE at $500,000 for fiscal year 27 and pass House File 3167. Thank you for your time and commitment to Minnesota's healthcare workforce. I'm happy to answer any questions.
Thank you very much, Ms. Vandenberg. Appreciate that. Again, the plan today is to hear the bill and then lay it over, so we're going to try to be somewhat brief. Representative Hussain, you have a question? I'm sorry, let me ask this. Is there anybody in the audience that wants to testify in favor or opposition of the bill? Seeing none. Member questions? Representative Hussain.
I don't have any questions, but I would like to thank you for bringing this bill forward, because I have family members who are in the nursing fields, and they always come and complain how many hours they are putting in this field and not seeing their kids, not being a part of the family. They are really passionate about this job, and it's a time that we need to address the shortage, the nurses that we see throughout our state. Thanks for bringing this bill forward, and I hope we can work this as a bipartisan together and to address the crisis that we see in our state.
Thank you for that. Other member questions? Chair Pinto.
Thank you, Mr. Chair. So one quick question. Is the funding, this may be to Ms. Sang, would the funding be in the base, be ongoing, or is it just one time? I was just trying to sort of, I think $250,000 in FY 27 means that there'd be $250,000 every year after that, but.
Clarification, Ms. Sang.
Mr. Chair, yeah, it would have to say it is one-time funding. But yes, right now it is ongoing.
Okay.
Oh, okay. We might need to talk about that.
And then, Mr. Chair, just a comment, and yeah, I will have further conversations, obviously, as we build the budget. I'll just note, connecting to our prior conversation about grant structure, it strikes me this may be an example of something, in my view, that actually would make sense to be a identified grant, in that if we say as a legislature we want a Center for Nursing Equity and Excellence, and there's only one place that would house that, then this might be an example of a place where that could make sense as opposed to a competitive RFP. We'll see how far we get. But I did also then want to note that I've been looking at having a healthcare workforce development competitive grant program, just recognizing that so much of the healthcare workforce, we receive a number of specific proposals here on that topic, and so that might be another avenue as well. But certainly recognize the important work that the U is doing in this area. And thank you, Representative Zeleznikar, for the bill. Thank you, Chair.
Representative Schultz, final.
Thank you, Mr. Chair. This is more so a comment. First, I want to thank Representative Zeleznikar for her continued work in regards to workforce for the whole healthcare space. I think you're clearly a leader on that here at the legislature. I want to make a quick note about the University of Minnesota and the challenges that we have in Minnesota in areas of higher education, and that is that we are in violation of the Civil Rights Act of 1964 as it relates to affirmative action issues, and this particular program is set up as such, and the University of Minnesota needs to come into compliance with federal law. Thank you, Mr. Chair.
Thank you. See no member questions. Representative Zeleznikar, final words to your bill.
Thank you, Chair Baker, and to Representative Chair Pinto. It is a one-time $500,000, so that will have to be amended.
We'll get that cleared. Thank you.
And clarified, just for the record. And secondarily, what I like about this program is it helps the entire state. It's a statewide initiative that's really important with our systems that are focusing on nursing, and it offers solutions with apprenticeships and giving mentorship in a very critical role of nursing that is. It can be stressful, but to have solutions to grow our workforce so that we can match the aging needs of our society right now in Minnesota, and then the ongoing needs that all Minnesotans will need. So I urge you to support this, and thank you for considering the bill.
Again, thank you for bringing this forward. The chair lays over House File 3167 as amended. Thank you very much. Next up, Representative Rehrauer has a bill in front of us, House File 4193, and the chair will move that bill for representative. And if her testimony, folks want to come forward now at this time too, we've got about 15 minutes left for the hearing. So again, this is an important bill. So welcome to our committee, Representative. and please introduce yourself and proceed with your bill.
Thank you so much, Mr. Chair, and thank you for your time management on the committee. I'm so glad you saved time for us here at the end. Thank you, members of the committee, for hearing House File 4193. This bill is really about choice and dignity and access for those who have disabilities and want to work. Specifically, House File 4193 allows individuals with disabilities the choice to receive Medicaid waivered services through a Department of Human Services authorized provider, or receive long-term employment services known as extended employment, or EE, through a deed authorized provider. The EE program is primarily structured through rulemaking and enforced by the Vocational Rehab Services, or VRS, with Indeed. For many years, under the rule, individuals used to have this choice of either utilizing Medicaid waivered services or the EE services. So thank you also to this committee, as I heard you discussing earlier today, your commitment in bipartisan nature to preventing fraud. And I want to share with you, to avoid any possibility of fraud, individuals and their EE provider would submit to VRS what is known as the Appendix K. It designates which service the individual was opting for and which funding was utilized. This is very effective. And in addition, I want to add that this is a pay-for-performance program. Since this rule change went into effect last July, the choice was eliminated and specifically prohibited by VRS. Even if you're only receiving housing waivered services, you're now ineligible to receive EE services. The result since last July is that in this very short period of time, there's become a backlog and waiting lists on the waivered services side and openings for assistance on the EE side that individuals can't access. If we don't do something about the problem now, it's only going to get worse. The EE providers throughout the state believe that this part of the rule is not in the best interest of the individual and it needs to be eliminated, and that's what this bill does. It restores a choice for individuals who need the services when they need the services. The EE providers have been in conversations with DEED and VRS about this needed change for more than a year. With the introduction of this bill, VRS leaders and EE providers have had productive conversations. But nevertheless, this bill needs to go forward, not only for accountability reasons, but I've been informed any change to this rule does require legislation. I just want to add that's a lot of acronyms. To just make it really simple, there was a rule change. It became enforced last July. Since then, we've got waiting lists for folks needing services, and this bill can remedy that. So, Mr. Chair and members, I'll stop there as we have some great testifiers who can give us more detail.
Thank you, Representative. First up is Ms. Janizek. If I said that right, please introduce yourself and proceed with your testimony.
Yeah, thank you, Representative, Mr. Chair, and committee members for allowing us to speak with you today. My name is Cassia Janizek, and I'm the Vice President of Vocational and Housing Services for RISE Incorporated, as well as the co-chair for the Minnesota Organization for Habilitation and Rehabilitation Extended Employment Committee. I'm here to speak with you today about Minnesota's extended employment program and the significant service barriers people with disabilities are experiencing throughout our state because of rule change that was implemented last July. The extended employment program is a long-standing, highly successful program delivering employment retention services. Using a pay-for-performance model, the program delivers exceptional outcomes for Minnesotans with disabilities and businesses throughout our state. In 2024 alone, 26 providers supported nearly 2,600 individuals who collectively earned $40.5 million in wages, which is more than double the investment the state makes into this program. In addition to programmatic success, extended employment includes some of the strongest safeguards against fraud. Providers are only paid after services are delivered. We undergo an annual independent audit, which is paid for by the provider. And we must maintain CARF accreditation, a nationally recognized rigorous accreditation process of more than 300 program standards. This is a program that is both effective and accountable. However, change to extended employment rule has had consequences, creating barriers for many Minnesotans in need of employment retention services. individuals on Medicaid waivers are no longer able to access extended employment services. The previous version of rule allowed access as long as providers completed a Schedule K agreed upon before services were delivered to ensure no duplication of services or funding sources were used. The rule change has reduced participant choice, increased Medicaid waiver waitlists, and especially impacted communities in Greater Minnesota. My colleague Shelley Borman will share more about these impacts. Thank you.
Thank you very much for your testimony. Ms. Borman, welcome to the committee and introduce yourself.
Thank you. Mr. Chair and committee members, thank you for the ability to testify here today. My name is Shelley Borman, and I'm a Workforce Development Manager for Goodwill Easter Seals, Minnesota. Officed in Wilmer, but I oversee staff that provide extended employment services in communities from Alexandria to Wilmer to Hutchinson and Mankato. While our agency is not a Medicaid waiver provider, the effects of this rule revision continue to play out in Greater Minnesota and have a significant impact on individuals with disabilities who want to work but need additional support services to do so. Our fellow employment provider agencies that do provide Medicaid waiver support services have growing wait lists on the Medicare waiver side at many of the communities up to nearly 1 to 2 years, many of which are also extended employment providers and have room to serve people in extended employment, but cannot due to the current rule. For example, a person we serve that was in a wheelchair and lives independently is on a Medicaid waiver for personal care needs only, was placed in a job at an assisted living center as a concierge at the front desk. And due to this rule change, she was no longer eligible and chose to end her support services rather than waiting up to a year for a different provider. The inability of persons to stay with long-term providers if there is a change in their employment, the extended wait list of Medicaid waiver providers, and the inability to serve persons on a Medicaid waiver quickly rather than delay job placement and support are all major challenges for persons served under the rule revision. I urge you to restore access to Minnesotans so they can choose the employment supports that work best for them. Thank you for your time.
Thank you very much, Ms. Borman. Thank you. Anybody else in the audience like to speak to this bill, for or against it? Seeing none, I'll close public testimony. Member questions for the bill. Chair Pinto.
Thank you, Mr. Chair. I might ask Dee to come up and just provide comment. I think I have a sense as to the, and maybe as Mr. Bowdry is coming up, my understanding is that there's conversations going on between the agency and the folks advancing the bill, but maybe if Mr. Bowdry could comment.
Thank you, Co-Chair. Welcome to the committee. Mr. Bowdry, introduce yourself and proceed.
Thank you, Mr. Chair, members of the committee. Devin Bowdry, Deed Government Relations Director. Yes, Chair Pinto, you're correct. There have been conversations between the providers and the deed side, and DHS involved as well. And as Representative Rehrauer has said, there have been productive conversations. I believe we've reached an agreement on what language could look like, and we're hoping to circulate that to our sides a little bit and then come back and adopt that language. But to a general sense, it's a 2-year trial of rule that would kind of avoid the duplication that was spoken to earlier, and I think both sides are in a good spot with it.
Chair Pinto?
Thank you, Mr. Chair. Yeah, and so and maybe, Mr. Chair, a question for you. I guess I'm thinking that then if we can come back with the language once read, either on one of your days or perhaps on one of our days, and definitely want to advance it. And so grateful to Representative Rehrauer has been leading on this your entire time in the legislature, making sure that people who have challenges in their work are receiving the support that they need to make sure that they can be contributing members of society, of our workforce. And just so much appreciate your leadership on this, and thanks to your testifiers as well. Thank you, Chair.
Thank you, Mr. Chair. Again, I think we're just kind of, as we're going to hold this over, if we get that language, we can pop it off and get it on its way too. So thank you for your support on that. And again, I know this is a bipartisan bill. You've got some good members on this bill. So Representative Zeleznikar.
Thank you, Chair Baker, and thank you for bringing this bill, because I think it's a really critical bill. in greater Minnesota and for the entire state. Prior to retiring, I worked with people with disabilities often at our workplace and coordinated and saw the absolute joy and the benefit of them having the opportunity to have gainful employment that match their needs, and to have extended employment program opportunities is critical for the disabled population. And it's also very critical for the business communities across greater Minnesota to help the operations run. And it allows for matches that work beautifully across the state. And I saw it firsthand in assisted living settings, and I saw it across northern Minnesota in various other settings. And I appreciate that you've worked hard on this, and I am grateful DEED is taking the initiative to fix this. This was a miss last session and had really significant consequences on disabled people in our community that want to have the same opportunities we have, as they should, to have meaningful work and have their own self-esteem and pride in that opportunity that comes from gainful employment. So thank you for your initiative.
Thank you, Representative. Seeing no member questions lingering, to your bill, Representative Rehrauer, to wrap it up.
Thank you so much. Thank you, Mr. Chair, for your support of the bill. I believe you're a co-author on the bill also, so I appreciate that. Thank you, members of the committee, and hope to get this worked out.
Thank you again, Representative. Again, happy to hear this. The chair will also just remember to remind members, the House File 4193 will be laid over for further consideration. With that, that ends our agenda for today, folks. We do not have a meeting tomorrow. We're going to give our friends a morning off to not have to get up quite so early. Chair Pinto, I'll give you the final word if there's anything else you have for next week.
Thank you. Yes, definitely chair of the not AM caucus, in addition to other things. Members, next week is our final week before the first and second deadlines, the policy deadlines. We'll continue our work after that, and still figuring out the precise agendas. But you can figure that things are going to be moving pretty fast and furious next week. Thank you, Chair.
Thank you, Mr. Co-Chair. Again, members, we'll see you following week. Enjoy the Eid holiday, and we'll see you soon. This meeting is adjourned.